This installment of parent training will explain how students access and qualify for special education, which now includes dyslexia programs. First, let's discuss what Child Find is. School districts are responsible for identifying, locating, and evaluating children with disabilities and who also need special education and related services, ages 0 to 21. Services must be available to all eligible students by their 3rd birthday. So before we talk about students' access to special programs like dyslexia, we need to talk about what special education is. Special education is specially designed instruction. This can look different for students depending on their needs and eligibility. Special education is not a place, but it's a service or support provided to students to help them access and progress through the general ed curriculum. Supports and services can take place in a variety of ways. One of the most common supports is inclusion. This is where a special education staff member goes into a classroom to provide support. All support provided is done to help students not only make progress on their goals, but also access the grade level curriculum. Content mastery and resource supports are typically provided in a special education setting, where more intensive supports can be done. A new law now identifies dyslexia programs as specially designed instruction. All types of supports can modify, reinforce, review, reteach, or pre-teach content. Other supports like speech therapy, occupational therapy, and physical therapy are supports which can be provided in a variety of settings. Finally, accommodations, modifications, and interventions are strategies and supports that are provided across settings to help students attain content knowledge. House Bill 3928, which passed in July of 2023, now recognizes dyslexia programs and dyslexia evaluations and eligibility as special education. TEA has defined dyslexia programs as specially designed instruction, which by definition is special education. The new law requires that before the end of the 24-25 school year, any student currently receiving dyslexia services under 504 will need to have a full individual initial evaluation, or FIIE, to determine if they meet TEA criteria of having a specific learning disability in the area of reading with characteristics of dyslexia. Due to the new law, any student who does not meet TEA criteria for specially designed instruction, including dyslexia programming, or whose parent does not consent to the evaluation or to initiate special ed services, will no longer receive dyslexia programming in the 25-26 school year through 504. Over the next 2 years, students currently receiving dyslexia programming through 504 will be offered an FIIE, and if they meet eligibility for special education, an individual education plan, or IEP, will be developed, which will include the dyslexia program. So, how do students get placed into special education? As I mentioned before, students are only eligible for special ed if they first meet TEA criteria for one or more of the recognized disabilities, and second, they have an educational need for specially designed instruction. TEA recognizes orthopedic impairment, other health impairment, deaf and hard of hearing, visual impairment, deaf-blind, intellectual disability, emotional disturbance, specific learning disability, which now includes dyslexia, speech impairment, autism, developmental delay, traumatic brain injury, and non-categorical early childhood. It's important to note occupational therapy or physical therapy alone do not qualify students for special education. So there are 2 ways students can get referred for special education. First, a parent can request testing for special education in writing or verbally, or a school can request testing through the multi-tiered system of supports program or during a 504 meeting. Once a request is made, the process begins. When it comes to dyslexia, the schools and the state mandate that universal screeners are conducted to help identify students early who may need specially designed instruction to try and intervene as early as possible when it comes to the reading. When testing is conducted, is done by qualified personnel like a school psychologist or diagnostician who are specially trained to evaluate students with different types of disabilities. Once a student is evaluated and meets TEA eligibility criteria of having a disability, a committee meets to discuss a need for specially designed instruction. And if needed, an individual education plan is developed. Again, to access special education programs like dyslexia, a student must first meet eligibility through an FIIE and have an educational need for specially designed instruction. Due to the new law, students who are currently being provided dyslexia programs through 504 must be evaluated through an FIIE, meet TEA eligibility requirements, and have an educational need for specially designed instruction to continue receiving dyslexia services beyond the 24-25 school year. If a parent does not consent to an FIIE, the 504 dyslexia services will end at the end of the 24-25 school year. So once a request for evaluation is received, the school gathers information for the evaluation staff to discuss the need and purpose for testing. The assessment staff will contact parents to seek informed consent or provide the parent with a refusal to test letter if there are any factors to why no evaluation should take place. Once the parent has signed consent to evaluate, the school has 45 school days to complete the full individual initial evaluation report. Once the evaluation report is completed, an initial admission, review, and dismissal, or ARD meeting, is held within 30 calendar days to discuss the results of the evaluation and determine the need for specially designed instruction. If there is a need, the committee develops an individual education plan, or IEP, of supports and services. At the conclusion of the initial ARD, the parent will be asked to provide consent to initiate special ed services. At any time, a parent or an adult student can revoke consent to that providing of special ed services, meaning they can be exited out or declined the special ed program. However, if the parent or adult student should ever reconsider their decision to revoke consent, the process starts over like an initial request for evaluation. In order to ensure we are updating and accounting for new needs and data, an ARD committee will meet at least every 12 months to review progress on current goals and develop a new IEP based on new information. Likewise, committee will meet every 3 years to review assessment data to determine if the student continues to meet eligibility and needs specially designed instruction. For more information on this topic, you can ask for information at your child's school or go to the Texas SPED support page at spedsupport.tea.texas.gov and or our co-op page at saspc.org and click on Parent Resources.